And welcome back to This Week. I'm pleased to be joined by Wendell Potter. He is a former 15-year executive of communications with Cigna Healthcare Insurance Company and also the author of this book, Deadly Spin, also a former journalist here in Middle Tennessee, West Tennessee, and East Tennessee.
Right.
Welcome. Thank you very much for your time.
Thanks so much, Bob.
You're kind of a whistleblower. You're kind of taking the lid off and pointing out the discrepancies, pointing out what health insurance companies do to basically profit on the backs of poor and uninsured people. I guess the question has to be, what took 15 years for you in this business to kind of say, I need to do this?
Well, two things. One, I didn't really know all that I know now until toward the end of my career there. I rose up the corporate ladder, and the more promotions I got, the more I could see of what the insurance industry does, particularly the for-profit insurance companies. Sure. And most of us now are enrolled in a for-profit plan across the country. Beyond that, though, it's hard to make a change, even if you are in a job that you don't like and you are questioning your own, I guess, your own moral compass. Sure. To a certain extent. If you've got to put food on the table, if you've got to pay the mortgage, it's a real consideration, and that's another reason. But frankly, I just ultimately got to the point that I had a crisis of conscience.
Was there an epiphany moment for you? You talk a little bit about an interview with Bill Mueller about right. a moment here in Tennessee at a healthcare expedition that you kind of said, this is really reality. People are really suffering out there.
I did. There's an organization in Tennessee, and I think your viewers may know Remote Area Medical, which is based in Knoxville, and it was holding what was called a healthcare expedition, not too far from where I grew up. I grew up in Kingsport, and I went there out of curiosity, and what I saw was just stunning to me. I saw people who I could have grown up with standing in long lines that stretched out of view, and these folks were soaking wet, and they were waiting, in many cases, to get care that was being provided in animal stalls and in barns. And I could not believe that I was still in the United States, and certainly not back home. And I had been able in my job to talk in numbers. Right. I knew that we had 45 million people at that time without insurance. Now we have over 50 million. But I was never confronted with that reality until then.
Putting a face on it.
Exactly, putting a face on it and seeing it face to face. And I knew immediately that what I was doing was helping to make it necessary for these folks to get care that way.
Your job was to kind of fend off folks like me from asking tough questions of the health insurance industry, which you did well. And you compare it in some ways to what the tobacco industry has done in regards to manipulating its message. And currently the healthcare industry has done a pretty good job, in your opinion.
They have indeed. In fact, the insurance industry has modeled its PR campaigns after campaigns that were created for the tobacco industry. Keep in mind that the tobacco industry for many years tried to make us think that smoking was not harmful to our health. Even after the Surgeon General came out with almost irrefutable evidence, they still were able for a long time to make people think that was not real science. And that they did the same thing years later when we were learning that secondhand smoke is not good for us.
What do the health insurance companies dislike about the recently passed President Obama's health care reform aspect, the fact that now that they can no longer discriminate against folks with pre-existing conditions, the public option, what do they do not like?
Well, they don't like that. They don't like the fact that they can refuse to sell you insurance because you've been sick. They don't like the fact that they are restricted in how much they can charge us if we're older. They can only charge older folks 3 times as much as younger people. They don't like the fact that the legislation requires them to spend just 80% of what they take in premiums on health care. They don't like a lot of the consumer protections of the new regulations, and they will be saying, quite frankly, when Congress takes this back up again and in the state capitals, that a lot of these consumer protections will raise the cost of insurance. And I think people need to understand that is part of the spin that we can hear coming from them next or from their allies. The protections that are in this legislation are really good for consumers. They will not increase premiums significantly at all, but it might keep them from meeting Wall Street's profit expectations.
Republicans will be and have said they're going to be challenging trying to repeal health care reform. We saw 2 summers ago the public hearings on health care reform. Are the health insurance companies going to be supporting this anti-message? Are they going to be supporting the attempt to repeal it, even though it looks like the Senate, the votes are probably not there?
The votes are not there, and the insurance company knows that, and the insurance industry knows that. It's not a sincere effort. I mean, honestly, I think some members members of Congress do think this bill should be repealed. I'm not saying that they're doing something that they don't think is the right thing to do, but I'm sure that the insurance industry lobbyists they've already had conversations with these folks and said, look, what we really need to do is not repeal this, keep it in place, and just repeal or retool, as they're saying, some of the consumer protections so that it's more favorable to us. So that's what the repeal effort is really, in my view, a smokescreen. And they're even using spin to characterize this repeal legislation. They're calling it the bill to repeal the job-killing health care reform bill. And that is nothing more than some spin that I would have created if I were still working for the industry.
Wendell Potter, author of Deadly Spin. Appreciate your time and your insights, sir. Thank you very much.
Thanks so much.
Stay with us as we continue in a moment.